Hello everyone, welcome to the postnatal webinar today. So today we are going to talk about what changes a woman faces after giving birth to a baby. And also we will also talk about how she can regain her strength and health back. Today on our panel we have Ankita Gaur, who is the founder of the Baby Body, and herself she is a mother and a certified AWPCT women postnatal expert. Along with her, we have Aarti, who is a senior yoga instructor, and she has an experience of more than 23 years in both post and prenatal yoga. So we'll move on with Ankita now.
Hi guys. Welcome to the webinar. Thank you for joining. This is this entire webinar is very close to my heart and comes out. We are gonna actually discuss the real world problems that women face after giving birth, and how we can actually get back our strength and our fitness and lose weight via yoga, via exercise, both. And we are going to discuss some really closed door problems which women actually face after giving birth, and which nobody actually talks about. Nobody prepares us before we are about to give birth to the baby. So yeah, quickly, I'm going to just introduce Aarti. Are you there?
Yeah, Ankita, I'm here.
Yeah. So Aarti and I together work on the program. Aarti is a yoga expert with us, and she leads the entire yoga panel and the yoga team. Myself, I lead the women health, exercise, and strength training program, and we have a team who kind of helps women to get back into fitness post giving birth. Not just fitness, but how to solve their pain, their mobility issues, their other health related problems. So yep, Ritu.
So we have a series of questions here. The first one that we would like to ask is, how does a woman's body changes after pregnancy?
Okay, so I'm just going to quickly take it over here. So when we actually are carrying the baby, the biggest and the most important the physical change that happens is the curvature of your spine. If you see the posture changes, most women who come to us at the Baby Body are they want to lose weight. That's one of the things they talk about. But primarily they talk about the posture change. So when we talk about posture, what happens is you're always feeding the baby and you are constantly hunching. So your shoulders are gone. Your walking style, because you have been carrying and your bump has grown so much, your walking style changes. You do not realize, but your gait, that's what we actually call in technical terms, that changes. Your back, so either you will, if you're carrying the baby, your back will be always like this, and you will actually see women in pregnancy or during pregnancy, they're walking like this. So the curvature of your spine changes, and you would not even realize when you have delivered the baby, your spine will be you will be standing like this half the time, or you will be like this. So these are the changes that happens to the spine. Your feet alignment changes in terms of how you are putting your feet on the ground. That changes. Now that is the posture change. Second comes to the muscular change, is which many women kind of ignore when we talk about muscular changes, are the strength in the stomach. Because the baby's constantly growing, your stomach, which is the rectus abdominis, it just kind of widens up further. Your pelvic muscles become weak because your pelvic muscles are the muscles which keep the baby in place. So when you are delivering the baby, especially in case of vaginal deliveries, it's the pelvic muscle which kind of pushes the baby also out, and the pelvic organs are all, it's kind of, they are squished. They're squished when the baby is growing in the belly. So diaphragmatic, because you are carrying the baby, you will realize, especially this in the third trimester, that you are finding it really hard to breathe because your diaphragm is constantly under pressure. So these are the few muscular changes. And when women talk about coming back to fitness and they want to lose weight, these are the few things they tend to ignore. which we, when we talk about, hey, you need to really start working on your pelvic floor strength, because that is one major shock the body has gone through. Then again, your abdominal muscles, the weakness in that is the reason why a lot of women get back pain and the weakness in the hips. So that's one. Second is ligament changes. When we talk about ligament changes are what you say, loosening of the joints. So there is a hormone called relaxin. The moment you conceive the baby and you're pregnant, the relaxin is introduced in the body, and it continues to be there post-delivery up to a year. And if you are lactating or if you're feeding the baby, that continues to be there as long as the lactation is going on in some cases. So what happens when the ligament changes happen? You are tend to twist your ankle very fast. You will see a lot of women twisting their ankle very fast. They get a lot of pain in terms of the joints as well, because there's a lot of pressure on the ligaments. So whatever exercise that you are picking up, especially within a year of giving birth, you have to be really, really cautious, because that could lead to really serious injuries. Yep. So these are some of the changes that we talk about mostly.
Okay, thank you, Ankita, for the insights. Another question that I have in my mind is, when can a woman start exercising post childbirth?
Okay, this has a drawn, this has the drawn answers across borders in different countries. So generally, by a thumb of rule, if you have given birth vaginally, or what we call as normal childbirth, you must, and I'm saying must because it has consequences, you must start working on your pelvic floor muscles, which are, and diaphragmatic breathing, and you can start actually within few days of giving birth. Okay, and if you go to a good hospital, usually they hand out these exercise sheet. Okay, you need to do this, you need to do that, you need to do this, especially in the case of a normal or vaginal birth. In case of a C-section, we really need to wait for the scar to heal. So we usually give a time frame of 6 weeks to 12 weeks. This is the time you should go ahead and let the scar completely heal, let your body recover, and then start. However, having said that, diaphragmatic breathing is something that we recommend every woman that they can start a few days after giving birth. Diaphragmatic breathing is just realigning your core to your breathing. That's very important.
Okay. And what are some of the challenges women face post giving birth?
Okay, this is so this is again like something which we usually don't talk about or don't prepare women. And I'm sure Aarti must be aware of it, because we see a lot of women now. They start with yoga, but this is a very common issue, and nobody tells you. Even we were not informed about these things. So most important or the most critical things that we hear when women after giving birth, especially after vaginal births, are your hip pain, your pelvic pain, anywhere pain in this region, because I'm going to keep on standing and demonstrating so that you guys have an idea what we are talking about. Anywhere pain in this area. Then prolonged sitting while feeding the baby, you will have a pain in your tailbone, which I actually went through. Then incontinence. So incontinence is something wherein you do not, because you have delivered vaginally, and incontinence also can happen in C-section if your diastasis recti is really large. Incontinence is the lack of control of your bowel movement or your bladder movement. So what happened is, most of these women who have delivered the baby, they do not have control on their urine. So if, let's say they are sneezing suddenly and they'll have a leak, and nobody talks about it. Especially women right now, they might not experience, but if you do not do your pelvic floor training immediately, or a few weeks after giving birth, women in the later stages, and you would hear this so often from your grannies, maybe your moms, that, okay, I'm 45 and 50 and I can't control urine. Serious case is the bowel movement control, which many women face. Then again is the diastasis recti. I'm going to come to that chapter because that needs a whole lot of discussion, and I'll bring Aarti into that. Then you have hemorrhoids. Hemorrhoids is again a constipation related issue. wherein you are trying to, poop and you're struggling with that. Back pain and hip pain, a very common upper back pain, tensioning of the shoulder, lack of stamina. Women want to walk, they cannot walk. A lot of joint pain and sensitivity. So when I talk about joint pain and sensitivity, there is something called carpal tunnel. Like your wrist, they start becoming numb by constantly holding the baby. All those pains are there. There's a thumb pain that women go. They have tennis elbow. Very common issues women go through post-delivery, and nobody kind of addresses those issues. So you might want to be prepared yourself. You want to prepare yourself by not always holding the baby in one hand, always changing hands, because this what happens in both. Because I got this and I was not aware of it. So your wrist will start becoming numb. So anytime you are going back to, let's say, post-natal or post-delivery exercise routine, watch out for these signs. Okay, anytime your knee is hurting, please back off. Anytime you're feeling a pressure on the wrist, do not let your trainer tell you, hey, it's okay to feel pressure on your wrist right now. No, it's not okay to have a pressure on your wrist, because if you in the first few months are having a lot of pressure, that is a sign that you might get a carpal tunnel, wherein you will have a constant numbness in your fingers. Very common issue again. Again, holding the baby with one hand and you will have a tennis elbow. Very, very common issues. And we have a team of physiotherapists. They tell us that this is one of the common issues women come in with. Thumb issue. So if you are, this is again, you are feeding the baby and you're constantly using your cell phone with one hand, this is going to have a severe pain. We call is the vein. I don't know the exact term. I'm sorry about that. But this is another sign. So joint pain, ankle pain, knee pain, elbow pain, wrist pain. Please watch out for these signs in the initial stages of postpartum. Because what happens is if you ignore these signs, then they take a serious course and you will have to go through a rehab. So yeah, these are some of the very common changes that we do. And then another very intimate, pain that women don't talk about is having intercourse post-pregnancy, and they go through that pain. Again, it's reason of a pelvic weakness and abdominal muscle weakness. And yeah, that is one thing that nobody talks about and nobody tells you about. So these are some of the very critical changes that you really need to focus on and be mindful of them. Yeah.
That was really insightful, Ankita. Can you also throw some light on what are some of the benefits of exercising immediately after birth?
So, see, the exercising after giving birth has tremendous benefits. Let me tell you. This is something from my own personal experience. I'd say. The moment you start, and we're not asking you to start exercising, just a normal walking around the house, and we see a lot of water retention in women who have delivered the baby. That comes down a lot. Earlier, women were asked to completely bed rest post giving birth, but now the hospitals who are more informed, the doctors are aware of the science and they're more knowledgeable. The gynecologists tell their or the OBGYN always tell their patients that, okay, you have given birth, it's okay to walk around the room. What that does is it reduces the water retention, also helps you recover faster. Healing gets better. If you have delivered vaginally, take a few days off, and the first thing that you need to do is start regaining your pelvic floor muscles, because what happens is when you are delivering vaginally, I'm going to show this to you, and women who have delivered, this is the area, it splits, your baby is out here. Everything from here to here becomes weak. So everything is, because we have pushed the baby out, everything was here, now it's all hanging down. So your pelvic floor organs are right now kind of squished and all loose. So you really need to put everything back in place. That's how it is. And what happens is when you do the basic exercises, which not the intense ones, and we never recommend starting intense, these things start first healing you from inside, strengthening the muscles from inside, and then you should start loading. So definitely start with walking if you're not aware what by the time you're figuring your baby's routine, you are not sure what you should do, because walking itself will maintain your endurance, but it will help you recover much faster. The cardiovascular health is definitely better. Yep.
Great. Can you also throw some light on diastasis recti?
Yeah, so diastasis recti, I'm just gonna change the slide here. I'm gonna get back. Okay, so what is a diastasis recti? And I'll bring Aarti also in because this is a very common question. And one thing has quite a huge impact on a lot of women who have delivered the baby. So what happens is, when you deliver the baby, or when you're carrying the baby, you would see there is a line, a black line, which we call alba, and it just kind of stays stuck from here, which is basically your rectus abdominis, which was earlier here, has split into two. So as the baby grows, this grows completely. Okay, now and then it starts, everything over here is, which used to be very tight and strong, now has become absolutely loose. So what happens when it becomes loose? Your core strength becomes very weak. When your core strength becomes weak, you get back pain. The majority of the women with diastasis recti have severe back pain. Then your other abdominal muscles, which are your transverse abdominals, which run this way, those become weak. We have incontinence. We face hip pain. And then there are hemorrhoids, constipation, because everything is related to the core. Core is, again, it has your intestine are somewhere, in comparison with the core, are also colluding together to make your body strong or weak. So everything around that becomes, so women who have delivered the baby. So we had this case where a woman was actually having serious hemorrhoids for 2 months. Okay, and she came and she said, I've tried every medicine, not working. So if you are having constipation and hemorrhoid is when you're trying to pass stool, or you're trying to poop, there's blood, or you are having difficulty, you need, along with the medication, you really need to work on your diastasis recti. Now, this can happen in the very initial stages. There are women who have experienced this even later in the postnatal, and I'm talking about later, up to 9 months or up to a year. I had a mom who was going through this, and she was literally struggling. And I'm not going to name her. She's a doctor. We started strengthening, and it actually disappeared. So this is some of the things that just a diastasis recti. And what is a diastasis recti? Basically, we see this tummy and it's hanging out. I'm going to show this to you right now. Okay. And I'm going to blow this. So everybody says, oh, I have a mummy tummy. I have a mummy tummy. Basically, a mummy tummy. This is basically a mummy tummy. So even though a mummy tummy is a lot you can reduce it with food, exercising, and everything, but diastasis recti, a common name, is mummy tummy. So when we talk about we can work on your mummy tummy, basically this has to get back in. So there are women who have delivered the baby, and after 2 years or 3 years later, they have this issue. They will look like as if they are still pregnant. And they come to us and they say, I have delivered the baby 4 years ago, and I'm still having a diastasis recti. And it's very easy to, I'll maybe ask Aarti also to jump in a little bit in some time. So it's very easy to kind of find out. Either if you can't do it, go to a physiotherapist or a women's health expert and ask them to check whether you have a diastasis recti or not. I'm going to show it to you later how you can self-diagnose it. And if you have that, great. There's a very common norm, again, in India, that, okay, you tie a kapda around your waist and it will bring the abdomen back. Oh, it's great. I tell you, to an extent, wearing a belt definitely helps. What it does it will bring and it will reduce your tummy to an extent, but it will not heal you from inside. So why an early, the Kegel, what we talk about, or when we talk about diaphragmatic breathing, are important because they start strengthening from inside. A cloth will only do a job 50%, not more than that. And like again, healing of the rectus abdominis, I've written over here at the bottom. Within 6 weeks, it is done from where you were. Let's say your strength was 100% before getting pregnant. In the first 6 weeks, your strength will only be 50%. Okay. And if you are exercising and you're active, by 7 months, or let's say next 6 months, you will only get your original strength by 75%. And most women who do not even exercise, they never get their strength back. It's only 50%. And it is so important to get the strength back, because that's where women who complain of constant back pain, constant hip pain, knee pain, etc., all the moment your hips are weak, your knee will start taking an impact. So this is very, very important to understand why we need, and the reason why I'm saying 50%, 75%, because women want to lose weight immediately. Within 6 weeks, they are saying, okay, I want to go to the Zumba. I want to do kickboxing. What happens is your core is not strong. It's still healing. So when you are doing Zumba, or let's say, because I'm also a marathon runner, and you are doing this is not strong. What happens? Your pubic region starts bearing the load. Your tailbone or your lower region start bearing the load. And that's when we see a lot of injuries. Women with osteoarthritis pubis, women with tailbone pain, women with knee pain, ankle pain showing up, and it's not going. It takes months and months to heal. Yep. So I'm going to just quickly take opinion, and I want to get some light in from Aarti. Aarti, how can you help us? How do we handle diastasis recti in yoga?
So there are a few precautions we need to understand before we know whether we have this condition or not. So I think Ankita will also demonstrate how to identify whether you have a DR or you don't have a DR. And based on that only, people have to start their practices, be it exercise or yoga practices. Coming to my subject of yoga, there are certain practices that you should not do if you have a diastasis recti, and there are certain practices we should definitely do in order to actually reduce that gap between the two finger, or more than 2.5 finger, when we insert it right at our belly button. You can do it sitting, lying down, any position that we will demonstrate in a while. There are certain practices which you should not do, which almost it separates the abdominal walls, right? And it keeps on increasing if you do those practices. Similarly, in yoga also, we have these practices called the crunches, the planks, the scissoring action. All of these are practices which you should not do if you have a DR. And the practices which you can do that can actually help you to actually curb that kind of a bridge between the abdominal walls is lying down bridge position, the heel tucks, the plank with the wall assistance, or the reclined, core contractions. All of these are the ones which will help you to reduce the DR gap between the two abdominal walls. So we will demonstrate also, in a while, actually, how to actually do these practices at your own, recovery phase, and at the same time do it with a lot of caution. Not to jump to conclusions, because there are certain things that we need to follow when to start yoga itself, in terms of after C-section, after a vaginal birth. So these are some things we should bear in mind before we start any yoga practices.
Awesome, thank you. I'm gonna, so the yoga, so we have divided these two sections, Aarti. One is the exercise part, and I would definitely ask you to kind of ask the yoga related stuff with you, because I think that deserves a different platform altogether in a short while. But meanwhile, I'll just show you guys how you can, check DR. Okay, so I'm gonna lie down here. Bring this mat. I hope you guys can see, or I'm gonna just put my laptop down a little bit. Sorry about that. Okay, so you can check if you have a DR sitting down, like Aarti said, or lying down. Okay. The best way to do this is knee bend, all right? Lie down, okay? Just above. So ideally, a 3-finger test or a 2-finger test is a good one. 3-finger, and these could be sometimes gives you a false rating as well if you're not following the crunch right. So the crunch is very, very important. And how, to what degree you really need to crunch to check whether your abdomen has a gap or not. So lie down with your bent knees, okay, and just above your navel, I'm going to use a 3-finger and put your hand between your, just right above your navel, and try to come up with up to your shoulder blades. So it's a good idea if your shoulder blades can come up, and then you will understand if I have a gap or not. Anywhere between like this much or an inch or 2 inch is still doable and correct. 3-inch or 3-finger gap is a lot. You really need some physical help there, and you need to do some exercises. 2-finger is, and most likely most women already have the diastasis recti heal. 4-finger or more than 3 is when you really need or could need a surgical help, and that happens when you are actually, in cases of twins, multi triplets or quadruplets. That's when you will have more than 3-finger, and that's actually a kind of serious thing. So 2 fingers to 3 fingers can be easily can be corrected by diastasis recti exercises. And if you're having a 1/2 finger, and if you're active, like I was very, very active before pregnancy, so my diastasis recti was only, I think, a little more than 1/2 finger after 10 days after giving birth. So how active you are during your pregnancy and your strength will definitely determine how your postnatal recovery is going to be. But this is a very easy exercise, and you can just make sure that you are going only up to your shoulder blade, crunching up to your shoulder blade, and not more than that. And if you have more than 2-finger or up to 2-finger, it's an indication for you to start doing exercise. A 1-finger, it's still okay. You can, it can still heal on its own. But 1.5 to 2 and 3, definitely you need to start doing some exercises. Okay. So, yep. Do you want me to show, Aarti, or you want to show some diastasis recti exercises here?
Since we are on the same topic,
yeah,
might as well finish it.
So we'll do one yoga maybe, or maybe one, maybe you show one and I'll show mine then.
So you can see me all right?
Yeah.
So when we are doing the normal bridge, we generally bring our legs closer to our hip region when we're doing normal bridge position in a yoga class. But for this, I would like you to keep it slightly apart. Just gently rest your palms down. Tuck your tailbone, draw your pubic bone inwards, and gently push your hips out away from the floor in this manner. That's all. You don't have to further lift up. Just keep your pubic bone engaged and tighten your pelvic floor muscles. Stay there for about 3 to 5 breaths and slowly descend downwards. You do this repeatedly for about 5 to 8 breaths continuously. Breathe in, hold there for about 3 to 5 breaths. Stay there. Exhale and bring the body down. So when you inhale, you continuously keep inhaling. Hold here. Continue to inhale and exhale while holding the position. But keep this part of the body tightly engaged, tucking your tailbone in. As you want to release, you slowly exhale and move out of the posture. All right. I'll demonstrate 2 more rounds. Breathe in. Hold it here. Continue to breathe. Don't hold your breath. You're holding only the posture. You're holding the muscles of your pelvic floor. And then as you exhale, you slowly bring it down. One more time. Breathe in. Keep connecting with this part of the body. You need to feel that connection and awareness to this part of the body when you're engaging them strongly. Exhale and come back. This is one simple practice that you could do. The same thing you do using the wall as you do a plank push-up. So if this is my wall, So my wall is here. So instead of arching the back, I tuck my tailbone in and I am pushing the palm against the wall and keeping the body slightly inclined in this manner. But at the same time, I'm doing the same engagement that I did in the lying down position. You keep pressing the palms against the wall, keep your pelvic muscles engaged and hold there for about 3 to 5 breaths. When you want to exhale, slowly relax, come to a neutral spine. All right. So keep your tailbone tucked in, no arching the back, nor leaning backwards. Okay, neutral spine, lean forward, place the palms against the wall support. So my wall is here, but I can't show you this way. So imagine there's this wall in front of me, tuck your tailbone in, and then keep pushing the palm against the wall. Hold it here, keep breathing out, and then when you want to release, relax and come out. All right?
Perfect. Okay, I have a similar concept, which is a little, we begin with this, however, and I'll show you two ways of doing it. Yes, this is recti exercise. Again, how Aarti demonstrated, start with the hip, the hip bridges. What you can do over here is, if you are lying down, to start with 90 degree, okay? And simply, the most important thing over here when we teach diastasis recti exercise in the class is to make sure that you're breathing, your inhalation and your exhalation is moving along with the way your legs are moving, or you're working on your abs. Okay, so this is very, very important. You can start with this lying down. Okay, now you're going to go inhale in this position, take it down and exhale and pull your tailbone in. Okay, now inhale, slowly touch your heel and bring that belly button towards your spine. Very important. Now inhale from your nose, exhale, take a longer exhalation and don't force it. Let it be smooth. Take a full deep inhalation and exhalation and bring your belly button towards your spine. And that's when it will start. So basically what you have to imagine that these are your two hip bones, okay? And they are attached with a string. Now you have to pull this together and pull it up. That's the movement you really need to think of. So I'm going to show you how you can do the sitting as well. Okay, so I'm gonna take this chair back. You can use, and this is some of the very initial exercises that we teach in the class. So I'm gonna be here. Want you to look at my palm. So take a ball, any ball if your child has a ball, or a pillow, or a stuffy toy. Okay. Now I want you to slightly just squeeze this a little bit and inhale and maybe just tap out and tap in. Now tapping out is inhale and exhale. Try to pull your tummy together and bring it in. So inhale out, exhale, bring it in. Inhale out, exhale, bring it in. Inhale out and exhale, bring it in. These are some of the exercises that you can start or you can do to correct your DR. The first two I would recommend. The first two that you did, maybe start with Aarti's, the bridge and the wall support exercise. And when you want to scale this up, maybe just put your legs 90 degrees and do the heel taps. Once you're up there, just take a ball, sit down. Don't have to do. If you're feeding the baby, take the baby here, put the ball or the pillow, whatever you have, and just do inhale. So I'm going to show you my face as well over here. Okay. Inhale, exhale. Inhale, exhale. Inhale, exhale. And one more thing I just want to point out, especially with the newly postpartum mothers, please do not spend too much time in the first month itself sitting. Try to lie down as much as possible. Let your lower back, because again, your joints are very loose. So try to lie down and avoid sitting too much. Walking is great, do that, but sitting is definitely a big no-no for you, especially in the first three weeks post-birth. Yep. So that's diaphysis recti. And
Thank you, Ankita and Aarti. That was very nicely explained. Another common question is that why is it so important to strengthen the inner core muscles from inside and the pelvic floor muscles before women take on intense exercises?
so like I explained earlier also, and I'm sure Aarti would also recommend. It's so important to kind of work in this area because your urinary bladder, okay, your bowel movement, your spine, your hip, your every movement is kind of starts from here. In Hindi we call this dhad, and in this is the entire course. The core is not just this. This is a wrong notion that we have. The core starts from here and it's still here. So we really need to strengthen, and this area bears a lot of load. So rather than just tying a kapra, which a lot of women, or a cloth around your waist, just wearing a belt, you need to strengthen this from within first, and then go get on to really high intensity exercises, including, let's say, running we are talking about, or people want to do Zumba, they want to go back to their dance class, they want to do kickboxing. You really need to have this in place. Right now, this is here. Okay, right now, since the baby, everything is like squished inside when you were carrying the baby and everything is down. You really need to bring everything up, make it strong, and then go. You reduce a lot of chances of injury. And we're talking about serious injuries and physiotherapy support and so many other complications that women have post giving birth. So yeah, another reason. Do you want me to show some Kegel exercises to these guys? And then I want because I don't want to take too much time. Then I want to go to yoga as well and ask questions, maybe Ritu. Otherwise we'll be taking too much time.
Okay, thank
Yeah,
you.
okay. Guys, I just want, thanks. So
I'm going to just want to add one point here, Ankita. So when you're returning back to exercise, I think you need to begin with a particular order, right? First, you work on your core, starting with your pelvic floor. Then you work on your transverse abdominal muscles, then your diaphragm, that is your breathing muscles. And then you go to your back, and then you go to your gluteus muscles. So I think this order has to also be followed in order to strengthen each of these muscles and then the whole body.
Correct. So this is exactly what I was like kind of coming to. This is what we have, that this is what you really need to do, benefit of exercising and how to plan for progress. So women, I know that, we are always in a rush and we don't want to look, we don't like to, honestly, none of us like the way we are looking. And if you are looking at a celebrity who has given birth and not carrying a mummy tummy, let's say Alia Bhatt, for example, or Anushka Sharma after 10 days of delivery, trust me, guys, that is not your real world. Real world does not work like that. They have chef support, they have personal trainers on their fingertips. They are not working, and they have nanny support, and they are not going rushing to go back to their 9-to-5 jobs. It is not the real world. So whatever you are seeing out there, please don't get inspired by that, because the real world problem nobody discusses. So you really need to, like Aarti said, you need to plan your postnatal progress. Again, diaphragmatics, everything, whether you are a C-section mom, you have a vaginal delivery, childbirth itself is very traumatic, no matter what and how it happened. Okay, if it's a vaginal delivery, it's even more traumatic. Traumatic in the sense, traumatic for the body. So you really need to kind of focus on first diaphragmatic breathing. Diaphragmatic breathing is getting your breathing back. And then looking at Kegel, then like Aarti said, gentle hip strengthening. Walking, definitely start within few days if you are feeling up to it. And working on motor control. Motor control is like small, simple exercises to get back your original form. That's what we kind of encourage, and that's what we teach also when we are taking women from their first month with us to the third month, and step by step. And then we have women who have never done push-ups in their life. and they deliver the baby, they come to us and they say, okay, are we going to do push-ups? And I'm like, yeah, we can do push-ups. And when you start working in a really order format, then you really make progress, and you would be surprised how much you can do. But don't rush your progress. I'm just going to quickly show 2 exercises. Whenever you deliver the baby, where you are, please do these lying down, sitting, standing, wherever you can. Okay, so first is the easy diaphragmatic breathing. You just have to place your hand. I hope you can see me, or you want me to just bring the laptop a bit here. You see me? Okay, great. The first is the diaphragmatic breathing. Wherever you are, even if you have done 6, you had a C-section or a vaginal birth, this is something which you can always do. Keep one hand on your chest, the other hand on your belly. Okay, and try to just get back your breathing, because right now everything was squished and we are trying to relax as well. So inhale at 4 counts through your nose, and exhale starting maybe with the same 4 counts slow, and then taking the exhalation longer. So let's say if you're doing it for the first time, inhale 1, 2, 3, 4, and exhale without stressing 1, 2, 3, 4. Do it a couple of days, and then as you progress, take maybe a day or 2. Inhale 1, 2, 3, 4. Now increase your exhalation to 1, 2, 3, 4, 5. Step by step. And a lot of people say, hey, don't focus on your belly breathing. And right now, you do not even know what belly breathing is. Your mind is so much occupied with so many things happening with the baby, not sleeping, crying, pooping, you're changing diapers for the first time. So just focus on breathing no matter where it happens. When you progress from a diaphragmatic breathing to Kegels, and Kegels are always not the best things to do, depending how tight or how good your pelvic floor muscle is. So Kegels definitely is a great way to start, but definitely need to increase some hip strength over there. So now when you're doing Kegel, now focus here. We're going to start with inhale, 1, 2, 3, 4. Exhale. Think about pushing your belly button to the spine and pulling your hip bones closer, and trying not to lose your breath, and maybe hold this for 1, 2, 3, 4, 5, 6 counts, and gently breathing through your mouth. The breathing technique will always make you do your Kegels better. So please do not close your mouth. Do not avoid the breathing. Again, I'm going to show you. Inhale, 1, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Just push everything over here like it is attached towards your rib cage. That's 1. Second, you can simply do this by lying, or if you are sitting or kneeling, if you're feeling tailbone pain, sit down in this position. Nothing, just leave the ball, leave the pillow, nothing. You're here. Inhale, close your eyes. 1, 2, 3, 4. Exhale from your mouth, pull your belly button towards you, and think your rib cage or your hip bones are coming together, and pull everything up towards as you exhale. Now, exhalation has to be like this. I'm going to come closer. Inhale through your nose. 1, 2, 3, 4. Exhale. Do not shrug this. Do not tense your body. Once you start doing these few exercises itself, you will see a lot of difference in your tummy, in your strength, in your hips. These are 1 or 2 exercises. I want Aarti also to show some yoga movements that we can do post-birth. Yep.
You're saying generally after post-delivery, or
yeah, so let's say when you, because I'm going to just jump onto you as well right now.
Yeah.
Okay, I will say let's start. What do you suggest, and when is the time for somebody to get on with yoga? Because we get people who have delivered the baby in like 3 weeks, and they say, "Can we start doing yoga, postnatal yoga?"
Yeah, so generally it's a matter of timing in terms of how you have progressed in your pregnancy, in terms of fitness, in terms of your journey in pregnancy, at the same time your delivery period, right? So if you've had a full-term baby, if you have had a premature baby, then obviously the recovery phases are very different, be it vaginal birth, be it C-section delivery. So, but ideally, if we look at a post-delivery format in terms of yoga practices, we always advise students to come back to us only after 8 weeks. 6 to 8 weeks is the minimum period that you should wait for until you have healed internally from your stitches as well as surgery if you've had whatsoever. But anything before 6 weeks is not considered to be a recovery phase because the body still needs time to actually connect to itself. There's no point of doing yoga practices if you're not aware of what you're practicing, because yoga is all about awareness. It's not just a physical practice. And if you're still healing, if you're still suffering with pain, then obviously the practice is not going to be very fruitful for you. So minimum 6 to 8 weeks is a must if you're coming back from a normal delivery, and definitely beyond that for a C-section, at least I would say 12 weeks. After that, you should start considering the yoga practices. Then it would be worthwhile for you to invest the time and effort in doing these practices, be it asanas, be it breathing exercises, or maybe a little bit of meditation also, because meditation requires huge effort. It's not that we simply close our eyes and sit down, but it requires a lot of internal focus. And if you're still suffering with pain, then obviously that exercise or that particular format of meditation is not going to be successful. So I would ideally say come back to us only after 8 weeks after you have delivered.
Okay, I just, because we're discussing meditation, I have like this postpartum depression. Women, I think a lot of women go through, don't want to admit it. They don't want to say that they are, they're suffering internally. And they don't, some are very clear about it that no, I'm not happy. I need a kind of meditation or some help. Women don't want to say that they are getting overwhelmed by the new baby, because suddenly before pregnancy, everything was about the women. You eat, you make her feel special, we are having baby shower, we are doing so many good things, buying clothes. The moment the baby is there, the entire focus shifts from the women, goes to the baby, and baby is doing fine. Let me tell you guys, baby is feeding, sleeping, burping, pooping, peeing, we are cleaning the diapers, happy new clothes, taking out for strolling. Women are the one who's doing it, and women kind of suffer through it, and nobody wants to talk about how doing just yoga or any exercise, or can we kind of lower down postnatal depression and postpartum depression, and how yoga can play a very pivotal role here. I think you're on mute. Can't hear you. Sorry. No, not audible. Sorry. Yeah.
Am I audible now?
Yeah.
Okay. So this term of postpartum depression or postpartum blues that we call, right? It can occur anytime, anywhere between, say, within 4 months, 6 months to almost 18 months after you deliver. So do not consider postpartum depression immediately after you deliver and then forget about it. It can go as long as 18 months to 24 months also, where you could come back to us saying that I'm not feeling like I am the normal person that I used to be before. And we do have certain practices to bring you back to that same pink of health that you had before you delivered. But I would say along with yoga practices, which would include breathing practices and meditative practices, although asanas can uplift you to a certain extent in terms of hormonal changes, but definitely you need to take the help of a therapist also to understand what is that you are going through in terms of the postpartum. And definitely medically also you need to check if you're going through certain kind of traumas, if you're not happy with the delivery, not happy with yourself as an identity. So what's happening to you? So that intervention from a therapist also is advised along with yogic practices. And definitely you can channelize your practices, twice a week in order to stay healthy in between the breastfeeding days, so that you discover certain poses can bring out certain symptoms in the body that can open up certain feelings and emotions. And those feelings and emotions can always be handled by these practices. So I would say there are a few practices that you should practice in order to curb the postpartum depression, like the puppy pose. I can demonstrate the puppy pose, the warrior two pose, the pigeon pose, Kapalbhati pranayama practices, or simple shavasana practice with yoga nidra, which is a deep relaxing state where you help you to release physically and mentally from the subtle body. So these are some of the practices that you can definitely do in order to come out of this zone of postpartum depression.
Harvey, could you just 2 to 3, and because we want to take the questions as well, if you could just really show some maybe two yoga poses that could help women dealing with confusion and all of that stuff.
So I hope
Yeah, you're good. You're good.
So the first pose obviously is the puppy pose, which you must have done in your prenatal yoga practices, where you're keeping your knees separated, hip width distance apart, extending your arms forward, dropping your chest and forehead or chin down to the floor. Keep your hips higher than your ankles and stretch your arms so as to release any tightness around your chest muscles, upper back muscles, and your shoulders. Stay here with a normal abdominal breathing for the next 8 to 10 breaths. And keep the breath very slow and continuous in a rhythmic way. Don't be in a hurry to breathe and come out. Although this posture may not be very relaxing for you, but try practicing it slightly away from the floor like this. And then slowly, once your body takes over, start pushing your chest down and bringing the body completely in. All right, so this is one of the poses. The second pose obviously is your warrior two, which is your standing posture, which is a strength-based practice. So you keep your feet separated about a little wider than your medium stance, pivoting your right toes out, bringing your knee in line with your ankle, and opening your arms to the side, gazing at your middle finger, and keep the steadiness in the posture. And focus right at your fingertips where you maintain the breath. Hold this anywhere between 5 to 8 breaths and understand what you're doing with your body and accordingly synchronize the breath with the movement. So this also brings that active state of mind into the posture for you to avoid any unnecessary thoughts. And then obviously you get centered and you be present with this. And the next few breathing practices would be Kapalbhati practice. You know, the strong forceful exhalation breaths that you do using your abdominals. That is the Kapalbhati practice, which requires you to sit in any comfortable cross-leg posture, keeping your shoulders and arms relaxed, keeping your spine lengthened. Relax your breathing initially to begin with. And then one strong inhalation and slowly you start exhaling, pulling the belly in and out, okay? Do this repeatedly for about 30 counts, 30 strokes in one go. Take a break and do it 3 times. So do this at least 2 sets every day, before a meal or after a meal. Give a gap of about 3 hours and practice it. So this will also help you to understand how your breath capacity is in terms of your diaphragm. And at the same time, if you can improve the breathing capacity, that's great for you to release any kind of suffocation within the body. And the last, of course, is Shavasana, which is the corpse pose, along with a guided meditation practice, which we call as the Yoga Nidra, which obviously you need to take a class to experience Yoga Nidra. Cannot be told now because it's a 40 minutes practice, but it has various stages of layering down the instruction for you to start from the body level to the subtle body, the breath level, and then the mind level, and then the subconscious level. So if we can consider taking you through this journey, obviously there is a lot of stored blocked emotions in our body that can help you to release that tension. And obviously there is a clarity in your mind and you know what you're doing as a mother. So even if you're breastfeeding, you're not doing it mindlessly, right? You're doing it with certain intentions that is transferred from the mother to the baby subconsciously. So this is very important why meditation also is so a part of our own self during the breastfeeding days. I always encourage all my students at least to do breathing and meditation, if not asanas, because there are certain limitations for the mother to do asanas because it's not conducive to take a space to actually also take time. It's best to do very short practice but effective practice. Yeah.
Awesome. Can we take some questions, Arti? Because I really don't want to hear. We have quite a few questions. Ritu, we have questions.
So we'll quickly take up some of the questions from the audience. So the first one is from Sona. Her question is that she has delivered 5.5 months back and she started yoga from 1 week. However, her knees are hurting and she thinks she might have hit it somewhere or maybe it might be a postnatal issue. She's not sure about it. And what can she do to heal this pain?
Arti, you want to take it up or?
I would just ask you to figure out if you have any weak muscles in the body, which means to say any of the joints which are very weak, starting from your hip joint to the knee joint, also the shoulder joint, because sometimes we unconsciously are not prepared to do certain movements and we hurt these joints when you're doing certain yogic practices also. So first try and strengthen these joints, do a lot of warm-ups so as to mobilize these joints and then start your yogic practice, because there could be chances, high chances, if you're overstretching in any pose, you could damage certain parts of the body, and not even damage, even that symptom of knee, which is very sensitive to pain, right, can actually bring out certain, drastic impact on the whole body. So go slow, even if you have delivered 5 months back, go slow in your practice, and patience is the key in postnatal yoga, because you need not hurry. You're not in a competition to actually match anybody's fitness here. So go slow and take your own body signals to move into the practice.
Okay, I'm going to answer this very differently and more from the scientific or the medical thing. Again, like I said initially, you are having relaxing in your body. Relaxing is again a hormone that will make your joints very, very loose. Now, primarily, women have knee pain, or anybody for that matter have knee pain, postnatal or otherwise. Postnatal, why? Because your hips have become very weak. When your hips become weak, which is going to happen when you have delivered the baby, the hip is the first thing that becomes weak. You really need to strengthen your hips with the right exercises to take off the load from the knee. We had two of the women in postnatal came to us with knee pain. And I think within 3 weeks or 4 weeks, the pain was gone, because we were focusing on not doing any, focusing first on the right, like Arti said, right kind of strength, then introducing any kind of, heavy duty or stretches or mobility. So you have to be very mindful. If you're seeing signs of knee pain, that is your call to take a step back, strengthen your joints, be very careful, because relaxin is a tricky hormone. And if you will keep on doing knee pain, or whether you have hit a floor or if that has happened or not, and if the pain is continuing, it can become chronic. So the first thing that we teach in class, if somebody is having a knee pain, it could be also your weight gain. I'm not sure, because I really not aware of it, but 90% of the time it is because of the weak hips. All right, let's go. Next question, please.
Yeah, so another question we have is from Pri. So she had C-section. Her question is that can she start 2 kilometers on the treadmill, and also what is the kilometer that she should target for?
Okay, I would coming from a sports background, and also a mom who has delivered the baby and kind of bounced back. Never ever measure your kilometers. All right, you need to spend time on feet. So maybe somebody like me might do 2 kilometers in 10-15 minutes. Somebody might do that 2 kilometers in 30 minutes. So depending, for you, what is important is moving for 30 to 45 minutes to begin with. 30 minutes, once you're recovered, feeling good, now it's the time, I've settled down with the baby. At least start with 30 minutes and make at least do 45 to 60 minutes a day. So women who cannot do or do not have time, I recommend them that no matter how much exercise you're doing, you really need to get your cardio in. So if you do not have too much time, divide 30 minutes or 20 minutes during the day into two parts. So maybe take out 30 minutes of time during the morning or afternoon when the baby's sleeping. 30 minutes, maybe you're taking the baby down for a stroller on a walk, whatever you can. So around 45 to 60 minutes is what you should look at to start with. Do not fall in that number game, 2 kilometers, 3 kilometers. Rather go on, focus on time on feet. That's what I would recommend.
Adding on to that, she also has a question that whenever she walks, she has pain in the center of her foot. So is it because of her shoes, or she should start wearing ankle support?
No, this is again weakness. Strengthening is hips. So what happens is that I'm going to just show you this because we are taught this as athletes, as women who, and I'm sure Aarti would also agree over here. Like I said, this is your area. Okay, this controls everything. The moment this becomes weak, your load will fall on the knee, then your calf, then your plantar fascia. So if you're having the pain under your foot, that is because your calves are too tight, which is very common during pregnancy. Why calves become too tight? Because the hips have become weak and the load starts falling down. So first thing, get your hip strengthening done. Second, to avoid or to get rid of the pain, initially what I would recommend is take a small ball, a golf ball or something, put it under your feet, okay, and just start rolling it. So I don't have a small ball, else I would have shown you. I'm going to show you with the big ball over here, but take a small golf ball or a tennis ball, put it under your feet. Yeah, a tennis ball is great, and just roll it. Just roll that. And it should relieve the pain. Do another thing, what you need to do is do some calf raises. I'm going to just show you on the treadmill here. Turn around this. Go on a staircase in your home. If you're in an apartment, go find a staircase, hold something. Okay, you're going to go up, slowly go down, up, and slowly go down. Repeat this at least 10 counts, at least twice. So do this 10 or 20 counts, take a break, then again 10 counts more, do this twice a day. It should give you relief and start strengthening these. Again, like we say, gentle hip strengthening is highly recommended. Okay. Ritu, you can go ahead to the next question.
Sure. So another question is from Mrs. Prem. The issues that she has been facing is that she has pain in her right buttocks after prolonged sitting and feeding of the baby. This pain only occurs during night, during the lay down. So what can she do about this?
Right pain, the right buttock. So again, we need to assess this. This could be a hip pain or a pelvic pain, either of them. So depending, because the hip pain or the pelvic pain also sometimes shows at the back. I hope it's not the tailbone pain. But then again, this is again lack of weakness that me and Aarti were just talking about. Aarti, I want to take your thoughts on this, please.
So it could also be any kind of probably hemorrhoids or a fissure problem. Or an infection around the anus that is causing the pain also. I would like you to consider how much of water do you drink, during this period, because that can also be actively, important for you to heal that kind of a problem. And obviously, if you are suffering only at night while lying down, this could be most probably one of the reasons. But otherwise, I would want you to check what is your water intake during the day.
Okay.
Okay. We have a question from Divya that it's been 5 years since she has delivered. So should she check for diastasis recti now? And is it possible to recover from it?
Oh, yes. So this is something which is so common. We have had women who have delivered baby 10 years ago and still are carrying diastasis recti. So you definitely should check it. And if you have a DR issue, that can definitely be taken care of. So there are women who have 7 years post-delivery and they did not know about it, but are now aware that there's something called DR and they have gone ahead and got it corrected. So definitely doable. I'm sure Aarti will also do it.
So, in terms of the time duration, how much time does it take to, really treat a DR? There is no time duration I would mention, but it is the intensity of the DR that you have individually. It could be a 2.5 finger gap, 3 finger, 4 finger gap. So the more you have, the more time obviously it will take, and maybe your coming back to the practice would have been a longer time. So if you immediately start within 6 months, then it is easier to actually come back from that, diastasis recti gap to bridge the gap between the two walls. But if you're coming back after 3 years, the time duration taken would be a little longer, but it's not impossible. So you can come back to us even if you have not done it after a period of time, like 2 years, 3 years.
Okay, great. Thanks for the insights. Another question from Sushmita is that she has been facing pelvic pain since the 5th month of her pregnancy. So is this curable with yoga asanas, Aarti?
Pelvic pain in terms of postnatal can be different levels of pelvic pain. So you should really understand, in certain asanas we do use the pelvic floor muscles to a large extent. In certain asanas we use it just as a bridge to engage the pelvic muscles, but we use more of the back and the core muscles to engage for the asana. So when you're talking about how weak or how strong is your pelvic floor, then there is n number of asanas that you'll have to experiment on the body and see which one makes you more comfortable and which one tightens the pelvic floor more often. So I would recommend you check with us in terms of what has been your history of practice before and what is that you need to do in order to recorrect those kinds of practices.
Another question from Lalita is that she has delivered 3 months back and she has been facing knee and upper back pain since then. So if she starts doing yoga now, will that help?
Yes, definitely. I mean, 3 months, as I mentioned, right, minimum about 3 months is necessary for you to come back to a very healthy state of practicing any kind of asanas. Since most of the time women are sitting upright for breastfeeding, very rarely we lie down to breastfeed. It's important that we strengthen our upper body, especially the shoulders, neck muscles, as well as your upper back muscles. So there are a lot of practices in yoga that you can do preliminary before you start off with the asana practices like Surya Namaskar and other practices, so as to strengthen the back, strengthen the neck joint as well as your shoulders. So these are some of the areas that you need to discover if you're sitting for a longer duration, how you can lengthen the spine and sit in a right posture. And at the same time, the right kind of breathing will help you to understand whether you're using these muscles or not. If you're always slouching, if you're having a rounded back, obviously, along with the posture, your breath is also constricted. So that definitely, adds on to the misery of your body. So only when you open up and sit naturally, where you're encouraging the chest muscles and your diaphragmatic muscles to breathe wide open, will your body get stronger and open up. So definitely I want you to take a look at how you're breathing when you're sitting for your breastfeeding days and then work on the body.
Okay, I think I've been getting a lot of questions regarding the strength training classes and yoga classes. Definitely, guys, we do. This is actually one of our very prime product in the baby body. We do take classes for prenatal yoga, postnatal yoga and postnatal strength training. Somebody mentioned about sciatica pain. Somebody is talking about incontinence. Somebody is talking about a tear. Definitely, we have classes. Depending upon where you are, if you have and what your condition is, we first take a call and determine what product best suits you, and accordingly we go ahead and then assign you a live class batch. So the package starts at 2599 per month, and these are group classes, but we do not keep more than 10 women because it's postnatal, and we are very Aarti and my specifically very quality oriented, and we just want to make sure everybody's doing the posture correct. So 2499 is per month, and you get total 16 classes in it. Right now, if you sign up with us within the next 48 or 24 hours, you get extra 3 more classes. I think 19 classes in that package. So something like that. I'm just going to ask Ruthi to go ahead with that. But that we definitely have classes. The kind of women who, and I'm not boasting, we have doctors who take our classes. We have women who are VPs, etc. Not only in India and abroad. So Postnatal is a product that we designed specifically for Indian moms because there was nothing like this available earlier. So we actually take pride in it, to say the least. But yeah, so those who are asking, yes, maybe Rutu, you can just leave a note in the chat group. There are a lot of women who are asking to have classes. The batches run in the morning, in the early afternoon, in the late afternoon, than in the late evening. And you can join any batch if you are, because we understand we both are moms ourselves. We understand that if you are not able to attend one batch, we happily accommodate you and give you the freedom to join another batch, another timing, which is available for you. So from anywhere, whichever level you are whichever or whatever month or year you are after after your childbirth, there is a program that we have designed for you. And whether it's a sciatica pain, it's a knee problem, your calves are weak, you're constantly getting back pain, upper back pain, trust me, join the class. And I'm not even boasting, because you can just read about the product out there on Instagram. We have gone ahead and make changes in women's lives after giving birth. Yep. Sorry. There's a twin. Madam, body recovery after delivery for single to vacant twins, will it be same? How long someone has to wait for twins to start with these practices? With twins, you really need to, you must start first thing. You must start strength training, because the body has gone through a lot. Let's be very honest. You've been doing everything double. Okay, mentally also you are fatiguing everything. Physically, the body's gone through a lot, but I would suggest wait and settle down with the routine, because having twins is not, and delivering twins is not easy. Again, if you've had a vaginal delivery, there is a different protocol for that. If you've had a C-section, we take that into account and proceed further with the exercises. If you plan to start yoga with us post delivery, I think I would let Aarti go ahead and take that case for you. Aarti, I want you to answer this, please.
So obviously, if it is a twins, then your recovery phase will be slightly higher. Start with the pelvic floor exercises first, and then you can proceed with yoga practices. Obviously, we do not start with Surya Namaskars or any strength training practices initially. We start with gentle stretches, we do individual asanas, we do a lot of breathing practices, and then we do Surya Namaskar for you to strengthen the other parts of the body. So it follows a pattern in terms of building strength, building the body and mind together, and then working on flexibility.
Awesome. I think we're going to wrap up here. Aarti, do we have any more questions? I think we've answered most of them.
You can drop in your questions to,
yeah, you can drop it to the questions asked, or we can just share our number over here. This is the number. Any question regarding postnatal exercise, or you are going through a pain, or any help you want, this is the number, and that's the website. Just drop us a text and we'll go ahead and help you out over here. All right.
Great. I think it was a lovely session, and most of the questions that women had have been answered. And we'll get back to your questions. So post on with the number, and we'll get back to all of your queries soon.
Perfect.
Thank you, everyone.
Thank you, guys. Thank you for joining. Thanks, guys. Thank you.
Thank you very much. Thank you. Have a good day.